So in yesterday's lecture, we have classified those all receptors of adrenergic receptors. So they have classified into majority of the class, that is alpha receptors and beta receptor. This alpha and beta further classified into alpha 1 receptor, alpha 2 receptor. Beta receptor is further classified into beta 1 receptor, beta 2 receptor. Now in yesterday's lecture, we have also seen how they are classified and what are the mechanisms of actions or how they are going to show their actions. Now coming to this slide also we have discussed in detail how the synthesis of these neurotransmitters taken place in our body, as they are going to have beta phenylethylamine ring. हे सुद्धा आपण काल डिटेल मध्ये डिस्कस केलंय की this is the main ring which is going to give the pharmacological action, that is the action given by the neurotransmitters. आता त्यांच्या रिसेप्टर्स वरच्या ऍक्शन्स येस्टरडेज आपण बघितले. एखाद्या न्यूरोट्रान्समीटरची ऍक्शन अल्फा 1 रिसेप्टर वरती कशी आहे आणि अल्फा 2 रिसेप्टर वर कशी आहे. So this we have already discussed in detail. We are going to now jump to the a very important part of today's lecture is structure activity relationship of this ring. Which ring? Phenylethylamine ring. This is the main ring which is going to be present in all three neurotransmitters which are acting on adrenergic receptors. म्हणजे adrenergic drugs किंवा sympathomimetic drug किंवा sympatholytic drug हे टोटली या 3 न्यूरोट्रान्समीटर वरती डिपेंड आहेत. आता ते न्यूरोट्रान्समीटर्स कोण आहेत? एफिनेफ्रिन, नॉरएफिनेफ्रिन आणि डोपामाइन. आता या 3 न्यूरोट्रान्समीटर मध्ये आपण काल डिस्कस केल्याप्रमाणे which is the common thing? This structure is the common thing in all these neurotransmitters. Now we all know these neurotransmitters are biosynthesized in our body. पण त्यांच्या biosynthesis मध्ये if something problem is there, if they are lesser amount secreted, if they are majority amount secreted, किंवा if there is a communication gap between these neurotransmitters and these receptors, so त्या टाइपच्या डिसऑर्डर्स किंवा हे न्यूरोट्रान्समीटर्स ज्या रिसेप्टर्स वरती किंवा ज्या ऑर्गन वरती जाऊन ऍक्ट होणार आहे त्या ऑर्गन मध्ये काही प्रॉब्लेम आला, then we are going to treat these disorders with adrenergic drugs. आता adrenergic drugs ने आपल्याला ते ट्रीट करायचं असेल, so we have to design the drug by using same chemical moiety which is there in this receptors. It is going in our head. What I am going to convey to you. See, this is the main ring present in all the neurotransmitters. Now neurotransmitters त्यांचे functions regularly करतात. पण हे न्यूरोट्रान्समीटर्स ज्या रिसेप्टर वरती ज्या ऑर्गन वरती जाऊन ऍक्ट होणार आहे किंवा त्या पर्सन मध्ये न्यूरोट्रान्समीटरचं सिक्रेशन कमी प्रमाणात होत असेल किंवा कम्युनिकेशन गॅप राहत असेल न्यूरोट्रान्समीटर मध्ये आणि रिसेप्टर मध्ये, तर या सगळ्या ज्या काही ऑर्गनच्या डिसऑर्डर किंवा डिसीज आहेत ते आपण ऍड्रीनर्जिक ड्रग्सनी ट्रीट करणार आहोत. आता हे ऍड्रीनर्जिक ड्रग्स आपल्याला तयार करायचे असतील, सिंथसाइज करायचे असतील, मॉडिफाय करायचे असतील, then we must know what is the significance of this ring to act on adrenergic receptors. Now what is the significance किंवा what is the structure activity relationship of this structure with adrenergic receptors? या स्ट्रक्चरचा अशाच पद्धतीनं असण्यामध्ये काय सिग्निफिकन्स आहे? how it is going to act on the adrenergic receptors? So we'll see one by one these structures and their parameters. Now there is importance or requirement of importance and requirement of these three properties. Number one property is beta phenylethylamine ring. हे आपण गेले 2 दिवस झालं बघतोय. If the structure is going to show adrenergic type of response, then it must have this ring structure. Which ring structure? Beta phenylethylamine ring structure. Okay. So what is this beta phenylethylamine? This is the beta phenylethylamine ring. Now, it must have second priority base catechol ring. Catechol is nothing but 2 hydroxyl groups at 3rd and 4th positions, which is present on the phenyl ring. This is catechol ring, and they must have 3rd priority basis 1 ROH. So there must be a presence of this hydroxyl group at first carbon atom, beta carbon atom. That means there is presence of beta hydroxyl group. It must be there in order to show adrenergic type of response by these all drugs. Now we have seen this is the main basic criteria should be followed, should be contained by these adrenergic drugs. Now we will see importance of these all contents of this ring. So we'll discuss one by one. There must be a presence of R1 substitution on this nitrogen atom. This nitrogen atom is must be substituted. So substituted केलेला असला पाहिजे. But if this R1 is substituted by different moieties, that means if this R group we have substituted with increased size of R1. If we are going to substitute this with for example, पहिल्यांदा आपण हायड्रोजन ने सबस्टिट्यूट केला. हायड्रोजन ने केल्यानंतर आपण मिथाइल ग्रुप ने केला, इथाइल ग्रुप ने केला, प्रोपाइल ग्रुप ने केला. जसजसे आपण रिंगची साइज किंवा सबस्टिट्यूशन ग्रुपची साइज if we are going to increase, then they are going to increase the beta activity. Increased beta activity means beta receptors activities are going to increase, but they didn't specify beta 1 or beta 2. That means it is increased beta activity and decreased alpha activity. That means if we are going to substitute this R1 group with increased bulkier groups of the structure, then it is going to increase the beta activity and decreases the alpha activity. Alpha activity decrease karte म्हणजे alpha receptors वरच्या activities they are going to decrease. Then they are going to decrease the degradation by monoamino oxidase. Now this enzyme we are discussing tremendous amount. Most of the cases we are discussing this enzyme. This is the enzyme which will degrade, which will metabolize, which will break down this ring system. Which ring system? Beta phenylethylamine system. कौन metabolize करते हैं, कौन break down करते हैं? It is broken down by the monoamino oxidase enzyme. But if we are going to increase the size of this R1 group, it will degrade or it will decrease the breakdown by monoamino oxidase enzyme. Manches, it will increase the lifetime of this drug to available in the systemic circulation. त्यांचा breakdown, त्यांचा metabolism stop करते, manches त्यांची availability increase करते. But if we are going to substitute this R1 group with tertiary butyl group, म्हणजे खूप मोठा tertiary butyl म्हणजे 4 methyl group substituted असणारा, if moiety here we are going to substitute, then it will increase the beta 2 activity. See here they have specified that what type of activity will be increased if we are going to substitute this R1 substitution with a tertiary butyl functional group. And if we are substituting this R1 with a tertiary butyl group, then the name of the drug is coleterol. So this coleterol will have a specifically increased activity on beta 2 receptor. Understood everybody? Now, and if we are going to substitute this group with a large lipophilic moiety, large straight chain compound म्हणजे here we have substituted tertiary butyl group की जो branched असणार आहे. But if we are going to substitute this with a lipophilic group, then it will increase the alpha blocking activity. जर आपण मोठा लिपोफिलिक ग्रुप घेतला म्हणजे फॅटी ऍसिड घेतले, लिपिड मॉलिक्यूल घेतला, तुम्ही बायोकेमिस्ट्री मध्ये डिस्कस केला असेल. जर आपण खूप मोठे लिपोफिलिक ऍसिड्स तिथे सबस्टिट्यूट केले, then it will give alpha blocking activity. म्हणजे this drug will block the alpha receptor, and the name of this type of drug is lobetalol. So have you understood the significance or structure activity relationship of substitution of R1 group on this beta phenyl ethyl green? Now the next substitution is R2 group. Here we have discussed everything. What type of substitution will give what type of responses. Now the second substitution is R2 substitution. If we are going to substitute R2 means carbon 2, alpha carbon atom. Alpha carbon atom वरती R2 functional group च्या substitution चा what is the significance? Now, if here we are going to substitute a small alkyl groups. Small alkyl groups means methyl, ethyl, then it is tolerated and decreases the degradation by this enzyme. Which enzyme? Monoamino oxidase enzyme. Because monoamino oxidase enzyme will metabolize this ring and decreases its activity. But if we are going to substitute this R2 position with a methyl or ethyl group, it will decrease the degradation by monoamino oxidase, means increases bioavailability, still substrate for हे जर आपण monoamino oxidase ना metabolism थांबवायचं असं, then we can substitute by methyl or ethyl group, but they are still metabolized by catecholamidyl O-methyl transferase enzyme, but they are going to have little effect on dopaminergic activity. So this is by methyl group. Now if we are going to substitute the ethyl group, या ज्या काही activities आहेत त्या methyl group substitute केल्यानंतर काय होतं? But if we are going to substitute this R1 group, R2 group with a ethyl group, so what happened? Alpha activities are increased than the beta receptor, and more beta selective drug molecule is ethyl norepinephrine. See, if we are going to substitute ethyl functional group here, so what happened? Alpha activity is tremendous amount of increased than the beta activity. But एक असा ड्रग मॉलिक्यूल आहे that is ethyl norepinephrine की जो काय आहे more amount of beta selective आहे than the alpha selective. Then if we are going to substitute ethyl functional group, it is going to increase the CNS activity, increased oral activity and dopaminergic activity. And if we are going to substitute 2S methyl group, there is increased alpha 2 activity. See, so this is the significance of substitution by different substitutions on this R group. See here, we have discussed the importance of substitution by different functional group R group, R1 group, different functional group kiva different substitutions on R2 group. Now we are discussing about the significance of this ring. Already we have discussed there is most requirement of 3 structural parameters: beta phenylethylamine, catechol ring. This ring is required, as well as presence of this 1ROH group. Now we are going to discuss what is the importance of presence of these 3,4-OH group on the, that is catechol ring, on this adrenergic receptor. Now, aromatic substitution, that is presence of 3-4- dihydroxyl group will give both alpha and beta agonist activity. Means presence of this both hydroxyl group will give both activities, alpha and beta agonist activity. This is metabolized by, this particular ring is metabolized by catechol O-methyl transferase enzyme, poor oral availability or poor oral activity and short dopaminergic activity, hydrophilic and poor CNS activity. This is the ring. If we change this 3-4 position to 3/5 position, that is metapropyrol. See here, basic criteria काय आहे? Presence of hydroxyl group, it is at 3 and 4- position. But if we are going to change this position to 3 and 5th, that means if we are going to shift this hydroxyl group to 5th position, then what happen? The name of the drug is metapropyrol. 3-CH2OH and 4OH, that is albuterol. So these substitutions are changed, will increase the beta-2 activity, will decrease the degradation by catechol O-methyl transferase enzyme, and increase absorption, oral activity, and dopaminergic activity. Now we are going to discuss individual significance of this 3-hydroxyl group and 4-hydroxyl group. This 4-hydroxyl group is more important for which type of activity? Beta activity. हा जो काही hydroxyl group present आहे, it is important for to show the beta activity as compared to if this 3-hydroxyl group is important for the alpha activity. आणि हे दोन्ही ग्रुप्स प्रेझेंट आहेत, म्हणूनच this beta catechol ring will give the alpha and beta both agonist activity. पण त्याच्यामधला this 4-hydroxyl group is required for beta activity and this 3-hydroxyl group is required for alpha activity. And the name of the drug is phenylethylamine, that is alpha agonist, because this phenylethylamine will present the hydroxyl group at 3rd position. No phenolic substitutions. If we are further, there will not be any substitutions on this phenolic ring, will decrease both alpha and beta. हे दोन्ही जर hydroxyl group नसतील आणि फक्त phenyl ring घेतली, they are going to decrease both alpha and beta agonist activity, direct or indirect activity. Now, what is the meaning of this direct and indirect, that we are going to see in the next slide. But before that, have you understood what is the importance of this ring in the adrenergic receptors? So this is a very important question. They may ask for the 10 marks also. In that case, you have to write this chart in your paper to explain the structure activity relationship of this beta phenylethylamine ring. Now, we have already discussed what is the presence or must criteria for this structure or for this ring. Now, for the catecholamines, the more potent enantiomer has 1R configuration. This enantiomer is typically 100 times more potent than the enantiomer 1S configuration. See, this is a ring. If this ring is present in this way only, that is presence of hydroxyl group on the above the plane of the paper, this is 1R configuration. आणि हाच hydroxyl group जर below the plane of paper असेल तर ते काय झालं? 1S configuration. मग हे स्ट्रक्चर जर याच फॉर्म मध्ये प्रेझेंट असलं, then it is going to give the 100 times fold more potency than the 1S configuration. Now we have already discussed what is the importance of substitution of this R1 group, importance of substitution. Now we have discussed, but we are going to discuss according to their names. If we are going to increase the substitutions from hydrogen to methyl to ethyl to tertiary butyl, this we have seen or we have discussed in that earlier side, the name of the drugs are changing. See, if that R1 group we have substituted with only hydrogen, the name of the drug is norepinephrine. which is going to be alpha is more active than the beta agonist. म्हणून या टाइपच्या ड्रगला कसला ड्रग म्हणतात? Alpha agonist. Which drug? Norepinephrine. Then epinephrine. Substitution of this R1 group with a methyl functional group will give the drug molecule or the neurotransmitter or the drug molecule is epinephrine, which will show alpha, beta 1 and beta 2 agonist action. See, it is acting on these whole different receptor. That's why it is non-selective. See, सगळ्या रिसेप्टर वरती जाऊन तो ऍक्ट होतोय. That's why it is non-selective. It is not selective in nature. It is acting on all the receptors. Alpha, beta 1, beta 2. That's why it is non-selective alpha beta agonist. Then the third class will be, or the third drug molecule is isoproterenol. Isoproterenol, that is ISO, will have substitution of ethyl functional group on the, that is isopropanol functional group on the R1 position. So this drug is beta 1 and beta 2 agonist. This is also non-selective beta agonist कारण beta 1 आणि beta 2 दोघांवरती पण जाऊन तो ऍक्ट होतोय. And the third drug molecule is, if we are going to substitute tertiary butyl functional group, so the drug molecule is N-tertiary butyl norepinephrine, which we can call them as a cortisol. We have already discussed. Yeah. Selective beta 2 agonist. We have discussed this in the first slide only. That they will convert the drug molecule into selective beta 2 agonist. जर R1 substitution upon more lipophilic drug molecule ने किंवा more lipophilic compound ने केलं, so it will convert the drug molecule into an alpha 1 blocking drug molecule, that is lobetalol. Then substitution of R2 group we have discussed. Okay, now the substitution of R2 group we have discussed. This R2 group, if we are going to substitute with a small alkyl group, will slow down the metabolism by monoamine oxidase. Then lipophilicity of R2 groups are increased केली, it will going to give the greater CNS activity. And ethyl group in this position diminishes alpha activity far more than the beta activity. So the name of the drug is ethyl norepinephrine and isoethyrene. Then alpha substitution on alpha carbonatum. Alpha carbonatum वरती alpha substitutions केले, that is 1R2S isomer that possesses significantly activity on the alpha 2 receptor. या टाइपचे substitutions. Now इथं आपण CH3 group substitute केला आणि हा hydroxyl group as it is, so it is going to be give selective activity towards the alpha 2 receptor. Now OH substitution on this beta 1 carbonatum. Now this OH substitution on beta 1 carbonatum is essential. See the word, it is essential. Generally decreases CNS activity largely because it lowers lipid solubility. See, presence of hydroxyl group will give the polarity to the drug molecule. म्हणून as it is going to increase the lipid solubility, as it is going to decrease the lipid solubility, it will decreases CNS activity. So compound lacking hydroxyl group have greatly reduced adrenergic receptor activity. This is must, this is essential. And हे जर नसेल, then it is going to lack or it is going to reduce the adrenergic receptor activity. Now we have everything we have discussed about this substitution on the aromatic ring. Already we have discussed. If we are going to move this substitution from 4th position to the 5th position, then the name of the drug is metapropylene. It will longer the dopaminergic activity as because the resorcinol ring is not a substrate for the catechol or methyl transferase. Then replacement of meta hydroxyl group of the catechol structure with a hydroxymethyl group. हा हायड्रॉक्सिल ग्रुप आपण हायड्रॉक्सी मिथाइल ग्रुपने सबस्टिट्यूट केला. Then the name of the drug is albuterol, which is selective beta 2 agonist. So these are the modifications and the structure activity relationship of this ring. वेगवेगळ्या पद्धतीचे substitutions करून what is the effect of this on the adrenergic receptor. Now substitution of this hydroxyl group with a hydroxymethyl group will increase the beta 2 agonist activity, and the name of the drug is albuterol. Then the removal of para hydroxyl group, ha hydroxyl group apan remove kela. Then from it will give phenylephrine, which lacks beta action but has less alpha agonist activity. If we are going to remove the hydroxyl group from this position, which will lacks beta action, but to the lesser extent, they are going to show the alpha 1 agonist activity. Now, a catecholamines without hydroxyl group. See, if both hydroxyl groups are not there, they are going to lose the direct sympathomimetic activity because becomes indirectly sympathomimetic. They are not metabolized by catechol O methyl transferase, and they are orally active, have longer dopaminergic activity, and the name of the drug, that is amphetamine, which is a catecholamine without hydroxyl groups. Now, aromatic moiety, or the second category of the drug molecule, which is going to have the similar type of structures. That is, पहिले ड्रग मॉलिक्युल्स आपण बघितले की ज्याच्यामध्ये कॉमन स्ट्रक्चरल पॅरामीटर होता बीटा फिनाइल इथाइल अमाइड रिंग. Now the names of the drug, instead of beta phenyl ethyl amide, there is presence of imidazoline ring. Now we are going to discuss the structure activity relationship of this imidazoline ring on adrenergic receptor. Now this is the basic criteria must be present in order to show the adrenergic agonist type of action, and the ring, basic ring is imidazoline ring. Now aromatic moiety must be there. Then this X is nothing but a bridging unit between this imidazole ring and the aromatic ring. Now, what is the importance of this bridging unit, or what is the significance of this bridging unit in the adrenergic receptor? This bridging unit, that is X, is usually CH2, that is methyl functional group, which is going to give the alpha 1 agonist or alpha 2 agonist type of action. Usually, a single methylene group are 2 aryl imidazoline derivative and a amino group 2 amino imidazoline derivative. Jar ithe a single CH2 group will be there, then the name of the drug is 2 aryl imidazoline derivative and a amino group is there, then 2 amino imidazoline derivative. ह्या X group जर आपण aromatic group ने attach केला, then 2 aryl imidazoline, and if it is attached to the amine group, then 2 amino imidazoline derivative. Now the names of the drug which are going to show the adrenergic agonist action is oxymetazoline and clonidine. Oxymetazoline, if it is there, then it is attached to the aromatic ring. This AR belongs to aromatic ring, and the next class in the case of clonidine is this X is become the amino group, that is amine ring. So 2 amino imidazoline derivative. So these are the 2 drugs which are going to have the adrenergic action on imidazoline derivatives. Number 2, that is importance of imidazoline ring. Imidazoline rings importance is open ring imidazolines. They are highly active alpha 2 agonist. Then aromatic ring. Agonist activity is enhanced when aromatic ring is substituted with a halogen substitutions like chlorine or small alkyl groups like methyl groups, particularly when they are placed in the 2 ortho positions. जर या पद्धतीचं substitutions if we are going to do in the aromatic ring with the halogens at ortho positions, then they are going to give the adrenergic receptor agonist activity. Now we are proceeding further for the sympathomimetic drugs. Hey, classification yesterday we have already discussed. The sympathomimetic drugs, that is directly acting sympathomimetic drug and indirectly acting and mixed acting sympathomimetic drugs. Now directly acting sympathomimetic drugs, they are endogenous catecholamines, म्हणजेच आपले neurotransmitters, alpha agonists, the drug molecules which are going to show the alpha agonist, dual non-selective alpha and beta agonist किंवा antagonist, and the last one will be a beta agonist. Now we are discussing in detail about endogenous catecholamine. Directly acting मध्ये endogenous catecholamines म्हणजे आपल्या बॉडी मध्ये ऑलरेडी तयार होणारे catecholamines, dopamine, norepinephrine and epinephrine. From the first will, dopamine, that is it is treated with a high dose, a vasoconstriction, alpha 1 action, increased heart rate, that is beta 1 receptor, and it is used in the treatment of shock. So this is the situation. We can treat the shock with a dopamine. Now the next one will be norepinephrine, which is used in the treatment of hypotensive crisis, means reduced blood pressure. So this situation we can treat with the norepinephrine as the drug molecule. And the third one will be epinephrine. We can treat the potensive crisis and nasal congestion. Nasal congestion means nasal glands secretion खूप मोठ्या प्रमाणात वाढले असतील, then we can treat this hypotensive crisis, म्हणजे blood pressure low झाला असेल आणि nasal congestion झाला असेल, दम लागला असेल एखाद्या पेशंट्सला, so we can treat that asthmatic type of situation with a beta 2 action. Now this is the classification of drug, but today we'll stop here. Everybody put down your attendance in the chat box.